Hey, have you ever heard of MedSearch Zambia? It's a new Zambian app that helps you locate hospitals, medical facilities, and pharmacies. Let's say, for instance, you're driving down Simon Lane and you open the app. It shows you, if you're looking for a pharmacy, it shows you where the pharmacy is located. And not only that, it actually gives you all of their information, their phone number, their contact details. Everything is right there. Instead of driving around looking for a medical facility or looking for a pharmacy, all you do is download MedSearch and all the information is right there. Isn't that awesome? Boom.
Simple terms, oral hygiene, it is simply the way we take care of our mouth. Okay, so I continue?
Yeah, I can continue.
Yeah, so like yes, I don't know if it was yesterday or today, I received some topics which I'm supposed to cover, but I'll be a little bit brief and somehow fast because I guess we've got limited time. Okay.
Yeah, true.
So among the that I was given gum disease, I was given bad breath, I was given tooth sensitivity, I was given tooth decay, I was also given flat teeth or fractured teeth, and I was also given root infection as well as enamel erosion. Okay, so to begin with, we have to start with tooth decay. Okay, tooth decay, simple terms, we can say this is actually the dissolving of the hard tissue of the tooth. Okay, so the way it starts, it doesn't just happen overnight or just in one day. No, it's a process, and the process is called the carrier process. So what normally happens is that after 2 hours of eating anything, maybe a snack or maybe shima, okay, and then someone doesn't brush their teeth, then after 2 hours, a biofilm is going to form which coats the teeth, okay, because the bacteria that is responsible for causing tooth decay, it doesn't stick on the smooth surface of the tooth. So there's need for something that is going to create some irrigation so that the bacteria itself, it can be able to attach itself. So the biofilm that is going to form, it is called dental plaque. So when the dental plaque coats itself on the tooth, it provides anchorage for the bacteria that is responsible for causing tooth decay. With time, the bacteria which is closer to the tooth, they begin to produce acids, and the same acids are the ones that are able to dissolve the hard tissue of it. Are we together?
Yeah, we're together.
Yes, yes, I am. So you find that if it is not controlled on time, okay, it may lead to other things. It may lead one to bad breath, the one which you're talking about, the one which we'll be talking about maybe in the next 2 minutes or so. Because when it causes some cavities, foodstuffs will lodge in there, and then when they lodge in there, they begin to rot if they're not removed, hence causing the bad breath. Then it causes also toothache. Okay, toothache. This is something which we can't joke about because the pain sometimes is too much. Okay? Then in instances, it also causes other infections such as the root infection, the one which I also talk about. Then it can also lead to other things that which we won't cover like of today. Okay. So the best way on how we can manage tooth decay is we have to improve our oral hygiene. That is by at least brushing 2 to 3 times in a day, every after a meal. The reason why we're saying that we have to brush at least 2 to 3 times, when we talk about 2 times, we have to brush in the morning just after breakfast. Then we also have to brush in the evening just after supper or when we're about to go to bed. So we are skipping the afternoon session because in most cases, you find that we normally go for work and it's very much impossible for someone to carry their toothbrush at work. So we normally advise the people just after eating anything, at least it's safe for someone to rinse their mouth. So after rinsing their mouth, then it's okay. Then when you talk about 3 times a day, there are people maybe who can manage to carry their toothbrushes at home. Then there are also those who are home. Okay. So every after a meal, that is breakfast, lunch, and supper, we normally advise them to brush their teeth. Okay. So coming to the next topic, we'll be looking at bad breath. Bad breath, this is simply, it's a bad odor that comes from the mouth, okay? This odor is not pleasant at all. And according to the statistics, in about every 5 people, one amongst them should have this bad breath. So bad breath is caused with a lot of there are so many things that causes. Number one, we may talk about chronic illnesses or infections such as bronchitis. We may also talk about those having tonsillitis as well as respiratory infection. Then it can also be caused by someone not brushing their tongue, because some of the people, they do have this what is called the fissure tongue. In that same fissure tongue, it has some fissures on it. And when they eat something, you find that the food stuff will lodge in those same fissures. Then when they begin to rot, then they cause that bad breath. And then the other one is for those people who have got xylostomia. When you talk about xylostomia, we are simply talking about someone having a dry mouth. So when someone has a dry mouth, you expect them to have this bad breath. Okay. Then number three, we have to talk about the people who do not brush their teeth. Okay, they're just moving around every after meal. They don't brush every afterward. They fail to keep their mouth clean. So those are some of the people we can categorize as the causes of what of the bad breath.
Maybe, maybe
So
a
the first,
question.
okay.
Yeah, people who are taking some medication. I think we have seen people who are taking, let's say, tramadol. There's a medication that make someone's mouth become dry. Can those contribute to one having a bad breath? And I think most of the people that we don't say, do children go on to have a bad breath, or is it just something that adult people will be having? Children cannot have a bad breath.
Okay, when it comes to the age group, bad breath, it doesn't choose. Okay, that includes the children, adolescents, as well as adults. Okay, we all have what is called the bad breath, because when you talk of kids and dental caries are more in children, because of sweets and chocolate and just sugary stuff, they take a lot of that and they rarely brush their teeth. So as a result, when those sugars begin to rot in the teeth, you expect that bad odor to come out from there. Okay. Then when you talk about xerostomia, there are other drugs that can cause xerostomia, of course. But in most instances, we can say, or let me talk from my experience point of view. I've never seen any drug that has ever caused xerostomia, but they are there.
Okay.
Yeah.
I think as we go on, I'll ask Namchimba to be looking at the questions that we are having. If there'll be any questions that people are asking, I've already seen one question with treatment. Louis Flores is saying he has heard and seen people using charcoal to treat bad breath. Is this a myth? Is this true? Should we all now just go buy 25 kgs of charcoal and just keep at home to be using it for having bad breath?
I wouldn't advise that. I wouldn't advise that because what people do not know about charcoal is that the moment you start to use it, okay, charcoal has got the ability to cause some fissures on the tongue. As a result, your teeth will become now susceptible to dental caries with time. Yes, it looks okay when you're doing it, but with time, it becomes something unbearable. So I would advise when people are going through what we're talking about or what we're going to talk about, let us visit the dental clinic, and they'll be able to advise accordingly.
Yeah. Okay.
So I don't know if I can proceed.
Yeah, you may proceed.
Okay. So the next topic we'll be looking at it's gum disease.
Mm-hmm.
So when it comes to gum disease, there are so many things that may cause gum disease. That includes you need to talk about cancer, you need to talk about tumors, and you need to talk about gingivitis as well as periodontitis. Okay. So for today's discussion, since we're just educating one another, we are
Yeah.
going to only look at gingivitis and the periodontitis. We won't talk about the issue of cancer and tumors. Okay. So the one when you talk about gingivitis, okay, gingivitis in simple terms, you can say this is bleeding gum. So the best definition that we can give is gingivitis is simply defined as the inflammation of the gums without causing destruction to the supporting structures of the tooth. So when you talk about gingivitis, it is only the gum which is affected. Okay. So the way it happens that the biofilm, which we just talked about, it will coat itself around the tooth. And then as it is coating around the tooth, okay, the bacteria which is closer to the gum will begin to irritate the gum. So as a result, the gum would want, the immune system which is found in the gum would want to fight back. So as a result, when the patient comes, you're as a dental personnel, you're expecting to see the gums appearing reddish in color because there's a lot of blood supply which has been sent to the gums, as in trying so as to try to fight back the infection which is there. Okay. Then number two, at home, the patient will experience some bleeding when they are brushing their teeth. Then number three, the patient may also experience some bleeding even when they just wake up early in the morning. Okay. So that is what normally happens. Okay. So what normally happens is that when that biofilm forms, it is able to create a surface which will enable other bacteria to attach to it. So as a result, they begin now to fight back. They now begin to irritate the gums. And then as they are irritating the gums, those gums now they become reddish. Then after that, when you come to the clinic, we'll be able to examine. And then when we examine, we'll pass through what is called the probe around your gums. And if you experience some bleeding while you're passing through that probe, we are going to say this is called gingivitis. It is only the gums which are affected and not the bone, not the tooth, not other supporting structures. Okay. So when it comes to the management of gingivitis, okay, the best thing that we can do is we have to improve our oral hygiene if at all it wasn't improved. Okay. That is actually enhancing our brushing every after a meal in a day. Then after that, we also need to do what is called we also need to use what is called a dental floss for cleaning it because the toothbrush can't reach there. Keep people who are, we can talk of elderly people, we can talk of people who are disabled. Okay, there's a special toothbrush which you can use for them, and it is called an electric toothbrush.
Okay.
So you can buy that, you clean them nicely, then from there they'll be okay. Okay, so when you talk about gingivitis, there are possibly three possible outcomes. The first outcome, after you enhance your oral hygiene, it will disappear. Then number two, it is either it will continue as the way it is as gingivitis. Then the third one, it will lead to what we're about to talk about, under the topic gum disease, which is called the periodontitis. So I don't know if there are any questions before we proceed.
Yes, we have one from Monica. No, from Louis Craig Sena, he's saying during gingivitis, can one use a lemon to treat it? I've got no idea. And this is what I think. We've seen this. Most of the time, people not want to come to a dental clinic. They would want to Google, and I know lemon has been one of the suggestions that Google will bring to say use lemon during if you've got inflamed gums or bleeding gums. So I don't know what you have to say about that.
The one which is recommended, okay, we can say they can use a lemon because the acid in that lemon can help. Yes, they can also use an orange.
So
The
yes,
ascorbic acid, yeah, because we need the ascorbic acid which is in that lemon to be able
okay.
to work on the gum. Yes. Then in other ways, if they're able to if they're able to buy what is called a vitamin C, then well and good, it's okay. Because the same vitamin C, which is ascorbic acid, is the one that is found in the orange.
Yeah. Okay, so far that was the only question that we had. And we encourage those who are watching us, if you have any questions, please do post them in the comments. Madam Namchimba will be able to pick them up and we'll be asking as we go on. If you are just joining us tonight, we are looking at oral hygiene. You're not really late, but you really missed a lot. We've learned about most of us who grew up with our parents putting activated charcoal, putting charcoal in our mouths that we can treat many conditions, and we've learned today we should not do that. We can continue, boss.
Okay, so now we go to what is called periodontitis. Okay, so the way periodontitis is different from gingivitis because periodontitis is going to cause now distraction to the supporting structures of the tooth. By the way, the tooth doesn't stand on its own in the mouth. It's got several supporting structures that support it. That includes the gum itself. Then there's also what is called the bone where the tooth is embedded in. Then there's also what is called the periodontal ligament, the one that is used for balancing the tooth. Then there's also the fourth one, which is called momentum. So in an instance where someone has serious gum disease, okay, we expect these structures which I've mentioned to be compromised because the way periodontitis is, it is going to cause a total destruction to these structures. So in most cases, people may be asking themselves, but what is it talking about? Okay, so just to simplify it in this way, we need to look at first the symptoms of this same periodontal disease, okay, or gum disease. Okay, in most cases, our patients will present with what? With mobile teeth. Their teeth will just become mobile. Okay, and then when they come to the clinic, okay, or most of them when they're at home, some of them, they'll even, when they meet you along the way, they'll even tell you, no, I've got calcium in my teeth. No, I've got green stuff which is attached to my teeth, and I'm requesting if you can remove it. Okay, so that same stuff which is attached to the tooth, it is the one actually that has got the inside it. Okay, there's a bacteria which is inside. In that same bacteria, it's got the ability to even dissolve the bone itself.
Wow.
Okay, so when the bone is dissolved, you expect the patient to come with the shaking teeth or mobile teeth. Okay, then on top of that, the 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 the, the, the same calculus which is formed around the tooth or the calcium, whichever name they may call it. Okay, when they come to the clinic, okay, they'll present with that, and then when they present with that, that same calcium, okay, it's got the ability also to cause what is called the gum recession. So meaning that the gum will move from where it is supposed to be, hence exposing the root surface of the tooth. And then when it exposes the root surface of the tooth, that root surface, it contains what is called nerve endings in it. And then hence their teeth will become very sensitive. Okay. So in most cases, The way we manage this, okay, there's a personnel who's called an oral hygienist, or you can visit any clinic and then they'll be able to remove the stuff that is attached to the tooth. Then after that, they'll try and enhance stability to the teeth. Then after that, you have to maintain it because it is very difficult to treat.
So far, there are no questions. Just like we said earlier, if we look at oral hygiene, I think it is one thing that all of us, most of us, have neglected, and because we don't have the knowledge that you're sharing with us, and we really appreciate for finding time and just educating us. Because for us, we just majority of us, I think we just wash our teeth in the morning, end of story, go to bed the following day, just like that. And then when certain conditions like periodontitis, if that is the correct pronunciation, we start we start saying maybe I've been wished to have a bad breath, or maybe I've been wished my teeth are falling off. So thank you very much. We can continue.
Okay. So the next topic that we have to look at is sensitive teeth. Okay. So when it comes to sensitive teeth, okay, one of the causes of sensitive teeth is gum recession. The way gum recession happens that there are other people who've got a tendency of brushing their teeth so hardly, such that they even end up traumatizing their gums. So as soon as the gum begins to heal, it will undergo what is called the shrinkage. And then when it shrinks, meaning that it is going to move a little bit from where it's supposed to be, going a little bit maybe up, exposing the root. So just like I said, that root, it contains some nerve endings. So those nerve endings, they tend to make the tooth sensitive. And sometimes even the foodstuffs that we eat, there are people who have got a tendency of eating acidic foods. Okay, so that same acid which is in that same food, it has got the ability to start causing a little bit of it's got the ability to dissolve the enamel. You know, when the enamel is dissolved from the tooth, it will mean that it will create some holes, and the holes which will be created, they will make it very much possible for the bacteria to be able to access the dentine. Because after the enamel, what follows is the dentine. So if the enamel is a little bit compromised, or maybe it's got a cavity of some kind, the next structure which is coming is the dentine. And we can say that the dentine is more sensitive than the enamel itself. So you find that when someone is having sensitive teeth, what you're talking about is there is a little bit of exposure of the dentine of the tooth, because it contains some nerve endings. So according to the professional advice that we normally give to our patients, is that they have to use a toothpaste which is called Sensodyne, so that it can reduce or it can get rid of the sensitivity from the teeth. Then in other advanced countries where dentistry has developed up to where we don't know, okay, they're able to do a surgery where they'll be able to put the gums where they're supposed to be. But in Zambia here, we are able to do that because we haven't yet reached that far in terms of our profession. Yeah.
I just have a quick question.
Okay.
Does mouthwash help in also just like what impact does mouthwash have? Does it have any credible, or is it really advisable for us to? I just want to understand what impact it has on oral hygiene. Does it make such a significant difference if you don't use it, or if you just use toothpaste like the one that you just recommended, which is Sensodyne?
Actually, I should even thank you for mentioning that. Okay. We normally recommend that, okay, but we don't just recommend it anyhow, because there are people who've got a tendency of buying anything, whatever they see on the market. Okay.
Whatever we watch.
Whatever you watch, whatever you Google, you want to try it. Okay. So the best that we can do, there are other instances where you're going to need the mouthwash, and there are also other times that you won't need the same mouthwash. Okay. So what you have in the mouth or what you present with at the clinic is what is going to determine whether you should use a mouthwash or not. Because in most cases, people, they just take it, no, a mouthwash works, a mouthwash does what, okay? If your toothbrushing is done properly, you find that everything will be sorted out there and then. Even the mouthwash, even the same mouthwash won't even be of greater importance, okay? So we normally advise people who've got the same gum disease to be using the mouthwash because we need them we need that for the gums to be able to rebuild itself.
Just a quick one. So Fofana is asking if someone has got a broken tooth and then they start seeing something black in it. Is it something that they should be worried? And then she goes on to say, can that bring about cancer? So I don't know how you can respond to her before we go back to.
Okay, there's a topic where we'll be looking at that. So we'll
Okay.
come to that.
Yeah. All right then. We can proceed then.
Okay. So the best thing is we have to attend to that question. Okay, where we'll be looking at the fractured tooth and maybe
Okay.
a broken tooth. Okay.
Right.
So when it comes to breaking teeth, there are so many things that causes that, and of which accidents are one of them. Those accidents, it may be RTA or maybe during sports such as boxing, football, netball, rugby, etc. Okay. So what will determine what is going to be done on that tooth is the extent of the same fracture. Okay. If the fracture has gone beyond the gum line, whereby it's able to go up there, meaning that that one is indicated for removal. There are no two ways about it. Okay. But there are other situations whereby the tooth will just be in the mouth. The fracture may be just a bit. Okay. And then when the fracture is just a bit, if the tooth can be restored, we'll advise them to have it restored so that we prevent infection from going inside there. Okay. So coming to our question, okay, there are other teeth which have actually changed the color. Maybe they were involved maybe in a situation whereby the tooth was hit. Then as a result, the tooth lost the sensitivity as well as blood supply. So such teeth, they tend to change the color. They normally become dark in color. Okay. So if the patient is not experiencing any pain, the tooth is just okay, we normally advise them to keep the tooth the way it is. Okay. But the moment it begins to give them a problem, we normally advise them to have it removed. Okay. So when they come to us, there are also other alternatives that can be done to the same tooth. Okay. Alternatives such as root canal, where you remove the nerve supply as well as the blood supply, which actually supply the same tooth. Then you can also do what is called apicectomy, where you cut the root apex of the same tooth. So the tooth will just be there in the mouth. It won't have any sensation, but it will be able to do its function. She talked about can such a tooth cause cancer? Let me talk from an experience point of view. Okay. The way cancer comes about, it doesn't come about because maybe the tooth broke or what. No, cancer is a different case altogether. Yeah. So just to answer her, it can never lead to cancer.
Okay.
If it leads to cancer, meaning that the cancer was already there, the only thing it was waiting for, it was an opening where once you make that opening, it will fly out from the bone.
Maybe just a follow-up question on her. From your experience, have you seen an increment or oral cancer in Zambia? There's nothing. Is it something that people should be worried about? Like when we talk about a statistic, from your experience here in Zambia.
From my experience, first and foremost, I have to testify that I've seen oral cancer before, and I've seen different types of oral cancer. Okay. People, they need to be worried of it, of course. But you know how our society is, because in other developed countries, when someone just develops a strange pimple, you find that they will go straight to see the doctor so that they can be advised of what is happening to them. Okay, but in our country here, you'd rather you see someone going to consult a doctor when things are already worse. You've seen that.
They only go to the doctor after they've Googled, after they've asked the neighbor, after the neighbors asked the grandfather. That is
Yeah.
when things are bad. That is when they'll come to the hospital. That is when they'll come to see a dentist or a dental technician.
Yeah. So just to advise our followers, our viewers rather, okay? We dental personnel, we are trained to see patients, okay? We are here for them, okay? When they come to us, even just coming for a checkup, it makes a difference, okay? A checkup is what is going to certify whether you're okay or you are not, okay? And when they are coming for the same checkup, okay, please don't just come alone. You come with your family so that all your family can what? It can be checked.
True. True. Thank you very
Yeah.
much for
So
that. True.
we are tired of seeing situations whereby it's only a man who comes alone. No, I want to have my teeth checked. Okay, this time around it's a woman coming alone. So we want to see situations whereby a family would come just to have their mouth checked. Then from there, we'll be able to advise accordingly.
Yeah.
Okay. So the next topic that we have to be looking at is root infection. Okay. So root infection, this is the infection that occurs when the bacteria has invaded in the tooth. Okay. So this infection, when it invades in the tooth, it's got the ability to create what is called an abscess around the tooth. Okay. And then when it goes down where to a point where it even goes out of the root, okay, it is able to create what is called now a big, which we can call a dental abscess. I guess we have seen other people who are swelling because of toothache. Yes. So for those, it is because the infection has what? It has gone down there to a point whereby it has actually gone out of the tooth through the roots, and then from there it is able to create itself there, so that that pus which will be formed, the pus will now begin to eat the bone, because pus is always an acidic environment. Yes. So in most cases, when such patients come, okay, we normally advise them to be on medication first, because in most cases you find that you may do an extraction whilst they are not on medication, and then after some time you find that some of them, the swelling will begin there and then, and for some of them, if they are swelling, the swelling will go down. So just to be on the safe side, it's better to put them on what is called antibiotic cover, even just for 2 to 3 days. But if the pain is so much such that it's unbearable, okay, what we can do just to help them, we have to put them on medication even 30 minutes before the procedure, so that they can be on antibiotic cover. As you are doing, the patient is already on antibiotic cover. So when someone presents with root infection, there are no two ways about it. The best thing that we can do is to have the tooth removed. Okay, and if they can be able to do what is called apicectomy, where they go to the apex of the root, then from there they clean it there, then everything can be okay. But if we're unable to do that, the best that we can do is
Okay. I don't know if Namchimba's got. Oh.
have the teeth removed if at all they have.
I have a question though.
Okay.
So I want to understand. Most people say toothache is one of the most painful experiences you would ever experience. So what causes toothache? so painful? What in the mouth that makes it so helpful and bearable for us to, be submissive?
I would request you repeat the question because
Yeah, you are breaking.
yes.
Can you know? Hello?
Yeah, we can get you
Yeah,
now.
we're getting.
Can you hear me?
Yes, we
Yes,
can.
yes.
Can you hear me now? No?
Yes,
Yes,
we're
we're able
getting
to.
you. Yeah.
Okay, so I was asking what makes a toothache so painful? What's in the mouth that makes it so unbearable for us to handle being under such circumstances, having a toothache?
Okay, so when it comes to toothache, the nerves that supplies the teeth, they are closer to the brain. And we have interacted with most women, those maybe who have been to labor before, and they will describe toothache as something very painful than labor itself. The
So
reason is that
there's
the nerves that supplies the teeth, they originate direct from the brain, okay? And then these other areas, they'll use the peripheral nervous system. So that's the reason why you find that toothache will be more painful according to others because of its proximity to the brain.
all right. We can continue due to time. We don't want to keep you this Friday.
Oh, okay.
Yeah.
So the next thing that we'll be looking at, I think we're supposed to be looking at enamel erosion, but allow me to substitute this topic because I want to talk about something which you haven't written here,
No
and
problem.
this has to do with babies. Okay, we have to talk about tongue tie because in most cases we have experienced a challenge as dental personnel. Okay, you find that a baby is born. When the baby is born, just after birth, you find that grandmothers, mothers, and other people, aunties, nephews, whatever, they will begin to what to examine the baby just after birth, just to check if at all the baby has a tongue tie. Okay, so in most cases, okay, as personnel, okay, we wouldn't advise anybody to check the baby, including the grandmother, the mother, the grandfather, the what. They have got no right to check the baby. And the most women, they don't know about that. Okay. You find that a grandmother will check the baby at home. Then after checking the baby, they will send the patient, the mother to the hospital. No, the baby has a tongue tie. Okay. Okay, if the baby has a tongue tie, okay. So what is so bad about this tongue tie? No, the baby won't be able to talk, you see? So I'm very happy because you have brought me on this platform and I've been looking forward to educating many on this. Okay. First and foremost, the same tongue tie which has been talked about, okay, it has got no ability of making the baby fail to talk because there's no connection between tongue tie and the speech. Okay. So if the baby is unable to talk, what we must be talking about is how are the vocal cords and not or we shouldn't even be talking about tongue tie first. We have to be more concerned about the vocal cords because that is where the voice is coming from as well as the speech. Okay, so in most cases, okay, there are only two circumstances that will allow us to cut if at all there's a tongue tie in the baby in the mouth of the baby. Okay, number one is at all if the baby is unable to pronounce certain words properly. That way we are going to do what is called a picolectomy, whereby we are going to do what is called frenectomy, where you're going to cut the string that is attaching or the muscle that is attaching the tongue to the floor of the mouth. Okay. Number two is if the baby is unable to eat, okay, because there's so much of frenum attachment Okay, so that way we'll have to do what is called phenyllectomy again. We have to cut the same tongue. So just to emphasize more, there is nothing that holds the tongue anyway. The only thing which holds the tongue, it is the same tongue tie. Okay. The other structures that follows, they are also salivary ducts which are there. Okay. Just to testify on that, the other time we had an incident whereby the grandmother somewhere was trying to cut the same tongue tie. Then they ended up cutting the blood vessel, and then the baby had to bleed to a point whereby the baby had even become pale. They had lost a lot of blood because they tampered with the blood vessel. Okay, so just to educate the people out there, okay, there is no connection between tongue tie and speech. Speech is coming from the vocal cords. Okay, and in most cases, in most cases, some of the people who are given out there to cut it from the compound, from in short, from the community, most of them we don't know their HIV status. Okay, some of them they might even be HIV positive. Some of them they might even have hepatitis. And then you give someone to do it for you. And what happens if that woman, she's got a cut somewhere, and then you create a wound in the baby's mouth? You find that the baby will have to suffer for something that which they couldn't actually, speak for themselves. Okay. So as mothers out there, okay, the recommended age, for checking of the same tongue tie, it is 6 months, because in 6 months' time, the baby would have developed a lot of structures, or most of the structures in the mouth would have become prominent. So as a result, we normally recommend for that age. And then in most cases, when the baby comes, or when the baby is brought to the hospital, there are times that we won't cut the same tongue tie, because we have seen that what the baby has, it is not what the mother knows, or what is in the mouth. So sometimes you find that you have to use your knowledge, which you acquired in school, for you to be able to make someone understand. But even if you do that, you find that the mothers will be there now attacking you. You don't know what you're doing. You don't know what. You don't know what. But
True.
you're using the knowledge that you have. Okay. So in most cases, just to clarify this, I don't know who told most women out there, such that the first going the father interest. Our interest is the baby being able, to say words in a nice way, or to pronounce them correctly. It doesn't matter whichever word comes first, whether it is the mother or the father, so long as the baby will be able to pronounce the word with us, it is okay. Okay. And just to conclude on that, there are times whereby the father is far away from the baby. Okay. And then the person who's closer to the baby is the mother, you're saying. But the mother will have to suffer, because the mother will have to teach the baby, to call someone daddy who is not even within the reach. Okay.
Yeah.
So just to educate them, we are not interested in whose name is pronounced first, whether it is mommy or daddy, so long as the baby is able
The
to
child talks. I've got a last question coming from Madam Caroline Hangoma. She goes on to say, should a pregnant woman check her teeth before giving birth? Is that something that they should do before giving birth? Is it important?
Okay, I would say it is important and it's not important. Okay. The reason why I would say it's important, because most women, when they're pregnant, they tend to have what is called the hormonal imbalances, whereby they have to balance the hormone, whereby some of the hormones will have to go to the baby, and then they have to remain with something, you see. So in most cases, pregnant women, they tend to become a little bit, for lack of a better term, they don't take, they don't normally clean their teeth. Okay. Most of them, you find that whenever they just become pregnant, some of them, they even stop brushing their teeth. When you ask them, but why were you not doing this? No, because that is where pregnancy took me to, such kind of ways. Okay. Then for those who are having challenges, if you want, you can come, then we'll be able to check, then we advise. Okay. If we see, for example, there's something wrong in the mouth, which we know to say this will affect you maybe within a shortest possible time, even before you deliver, we normally advise them to have it corrected. What we don't have is a tendency of making the hospital a friendly environment for all of us. Dental is not a department where people should be scared as if someone wants to check your HIV status, as if someone wants out, then after that, the patient accordingly. So I don't know if
I think it will be just in concluding. You've really talked about people, and I would want you to repeat that people should not be afraid of coming to the hospital to have their teeth checked. I think this is something important. We should not only come to the dental clinic when we see an inflamed gum or when people go on to complain about us having a bad breath. That is when they'll come to the dental clinic. I think you've said it properly. And just wanted to repeat, why is it important for all of us to go for a dental checkup more than 3 times in a year?
okay. So first and foremost, at first they used to say you have to, you need to have some examination or maybe some checkups after 6 months. Then later they changed from 6 months to 4 months. Then with time again they changed from 4 months to 3 months.
3 months, yeah.
So with me, what I can advise them is, you need to have checkups regularly. Okay, whenever you feel like you are free to come and see any of us. Okay, just having your teeth checked or examined doesn't mean that there's something wrong or what. No, it's just to see how far your teeth are or how healthy they are. We are here for you. We are not here to maybe like to cause damage or to cause harm. No. Okay. We are also tired seeing people coming to us when things are already bad. Okay. We also want to exercise other things which there are other things that we're supposed to practice, but we can't practice them because of what patients normally present with at the clinic. Okay, so we'd advise them, make a date with us. We are here for you. You are free to come whenever we are working. A checkup, it is not something which says maybe you've got something bad or what. No. Okay, and when you come for a checkup, don't come alone. Okay, you come with your families. Remember in the Bible, the story of Abraham, when God showed him the land where he wanted Abraham to go and live. Okay, he didn't go alone. He went there together with his family. So even when you come to us, you come with your family. Just make a date. No, today we have to go and see. We have to go and see dental personnel so that we can have our teeth checked. So that way, we'll be able to prevent a lot of conditions that normally affects the mouth. Because most of the conditions which affects the mouth are things which could have been avoided or things which could have been corrected when the time was still there. But if you come when things are already bad, you find that it will be very difficult for someone to even do what they were supposed to do when things could have been done at that time.
We as for MedSearch Zambia, we appreciate the time that you've taken. You've everyone in our comment are saying you've simplified so many topics within less than an hour, and majority appreciate. So from us as MedSearch Zambia, we appreciate you for coming on our page to talk about the importance of oral hygiene. We as MedSearch Zambia, unfortunately, we want to join the rest of the country in paying tribute to our former president, President Rupia Bwezanibanda, who has passed on. Our condolences to the family and to the country. MedSearch Zambia is a medical platform that we have created that is helping people be able to find the nearest health facility, have correct health information in their palm of their hand. Our application is free for download both on Google Play Store and App Store, and it will help you direct you to the nearest dental clinic that you're able to go for a regular checkup. Here at MedSearch Zambia, we always say MedSearch Zambia, healthcare simplified. Thank you very much, Mr. Mike, for joining us.
Thank you very much, and have a pleasant night.
MedSearch Zambia app, healthcare simplified.